Hey team, this is a super sweet, lovely patient with just the most glowing personality ever. And she came in complaining of bags under her eyes. So let's take a look at what she looked like beforehand and what we did and how she turned out. So on her lower lids, you can see that she has pretty big bags on over here, here, and there. On the lower lids, there's 3 fat pads, a medial, a central, and a lateral fat pad. So a lower lid blepharoplasty, I go in from the inside so you don't see any incision. And then I was able to just take out those fat pads so that they're gone. And you can see now there's no fat pads down there. Then the other thing I did was release her tear trough. So you can see on her, she has a pretty distinct tear trough. So the skin actually gets attached to the bone underneath it, and that's kind of what separates 2 layers of our body. So for her, I simply released the tear trough, and I didn't do anything weird or sexy like fat grafting or fat transposition. She just didn't even need it. You can see now the transition from her cheek to her lower lid is smoother, so there's not anything special going on there. And then the last thing was that she had previously had filler in her cheeks and in her tear trough, and she was complaining of like swelling, just kind of like, it didn't look like herself, it's just like a chronic swelling, kind of puffiness that happens there. Some people get like redness or inflammation, but she just had some swelling. And so for that, what we did is we did an enzyme called Hylenex. It's hard to see in these pictures, but people will typically have it in this area where they say like redness and swelling. Even if they had filler 25, 35 years ago, they can have that. So the enzyme, the Hylenex, it just dissolves it, and we do it with an ultrasound so we can ascertain exactly where, if there is filler left, where it is, how much is left, and then what layer it's in. Is it in the skin, the muscle, is it on the bone, what part of the muscle it's at? And so we're able to exactly and precisely dissolve the filler that's there. And so she's looking amazing. I am so happy for her. She looks like so great. But if you have any questions about lower lids, upper lids, that's all I do for a living. I'm happy to help you. Call us anytime.